From April 2022, people aged 16 or over who are registered with a GP in England will have full access to their future GP record online, as well as a number of younger people, aged 13 to 16, if they have requested access and are deemed competent by their GP to have that access. Note that this relates to the future record. It does not change access that they have to information recorded in their GP record before April 2022. Also, access to records by proxy will not change. For example, if a patient has proxy access to their child's record, this level of access will remain the same as it was prior to April 2022. Many of your patients will already have registered accounts that permit them to view a limited amount of their data online, and this access for any data present on their record before the 1st of April 2022 will not change. They'll still have access to it, but in addition to this, they'll see everything that is added to their record from the 1st of April 2022. This includes free text, for example if added in consultation mode or if added as additional information accompanying a code, and also documents that might be stored on the patient's record. For this reason, it's critical that all members of your practice team, including all clinicians, are careful about whether they choose to restrict the online visibility of content. The GDPR guidelines allow practices, as data controllers, to restrict access to data in certain circumstances. This means the following types of information should be removed from online viewing: data which may cause serious harm to physical or mental health of any individual, either the patient or a third party; data provided by a third party which has not been discussed with the patient; data which may put the patient at risk should the information be viewed by a third party through coercion or accidental viewing. We would suggest that as a practice you consider and agree on the types of document and the types of content that you want to hide from the patient. This will include safeguarding reports and letters, hospital letters containing test results or other sensitive content before you've had a chance to speak to the patient, documentation received from a third party which contains information the patient may not be aware of, information about patients who are vulnerable due to abuse or coercion, information about victims of trafficking or patients with a history of child abuse or violence, and consultations that may name a third party where the patient has not divulged the information themselves. Discuss as a practice and agree a protocol. It's important to note that a lot of the work will be undertaken by admin staff who are responsible for filing documents. Ensure that all staff and clinicians are aware of the new restrictions and what's required of them. You must be able to justify to the patient why the information has not been made available, should you be asked. We would advise that you don't wait until the 1st of April deadline to implement these changes. Set a date prior to April so staff have time to get used to the changes. Introduce standard procedures for the storing of all documents onto your system. In EMIS Web, when you attach a document to a patient's record, a consultation is automatically created. Ensure that all your teams involved in document processing know when and how to ensure that the consultation that has been created is not visible online. It's not a requirement at present to review data and documents on the patient record that were added before the 1st of April 2022, as these will remain hidden from patients. But it is critical to ensure that from the 1st of April 2022, it's established protocol to hide all documents and data as per your agreed practice list. The next video in this bundle explains how to use the online visibility function within EMIS Web and answers some common questions about its impact on other parts of the system. We'd recommend that you send a link to these videos to your practice team to make sure they're all aware of how to do this.